Hey there, Dr. Benedetto here, and wanted to shoot this quick video. For those of you who don't know me, um, I specialize in, I'm a functional medicine practitioner, and for a very long time, I've been specializing in helping people with Hashimoto's. Diagnosed my wife with it many years ago, over 12 at this point. And so then it became the mission. We became dedicated to and specializing in helping people with Hashimoto's. And so been doing that for a very long time. And um, what I want to talk about on this video is a question I get a ton. And so I figured let me just put together a little chart and let's go through this. Um, and the reality of it is I have a couple of different ways that I help my patients, a couple different levels of service, if you will. And you can see like three of them right here. Basically, there's a core three. And the deal with Hashimoto's is there are um, two boxes that we have to check on every single patient, right? Number one is figuring out what are their root causes, right? What are the things that are causing their Hashimoto's? Foods, hormones, adrenals, nutrient deficiencies, chronic infections, you name it, right? There's a lot of different things that it could be. Toxins, right? Mold and those kinds of things, environmental stuff. So we have to figure those things out. And then simultaneous to that, we have to implement what's known as an AIP protocol or an autoimmune protocol. And that's a system. I didn't invent the concept. I invented my version of it that I use with my patients. But it's called an autoimmune protocol. It's used for obviously autoimmune conditions. It's in the name. And that's a series of steps that we take that involve a dietary elimination. So eliminating foods from the diet and then some supplementation to help heal the body, right? Decrease inflammation, heal the gut, support the thyroid, liver support, detoxification, those kinds of things, cellular detox. And then we reintroduce foods down the road. So ideally we need to do both. And not ideally, we have to do both in order to get someone figured out. But over the years, I've come across many patients who wanted various levels of service. They're like, look, I just want you to show me how to do an AIP protocol, for example, right? So, years ago, all I had was like a high level one-on-one, like personal doctoring coaching program, which I still have and we'll go over. But that was all I had. And people were coming to me and they were like, that's not what I want, or price tag's a little much. Like, I'd like to start with this, and then maybe we'll talk about that over time. Fine. My goal is to get to as many people with Hashimoto's and help them as possible, wherever they're at, whatever they need, whatever they can do. Okay. So I wanted to take a moment just to kind of break down kind of the three levels of service that I offer. So that way you can review this and if you're interested, you can see if it's something that you might work for you and where you'd want to be. Okay. So this is kind of like our bronze level. Okay. So I have three different um, levels of service, if you will. An AIP protocol, kind of my core protocol, which I call my 90 days to Hashimoto's healing. That's my kind of most popular protocol. Um, and a very high level kind of one-on-one doctor with like you work directly with me on a personalized plan. And there's obviously varying levels of service that come with each of those and different price tags, the whole nine yards. And we're going to go over all that. I don't hide my fees. I think my fees are super reasonable compared to much of what is out there. And the results that I've been getting and we've been getting speak for themselves. So I have zero problems with my fees because of the results that we get. I think they're super reasonable because of that. A lot of people not getting the results that I've been getting over a very long period of time that are charging exorbitant fees. I don't like that. So that's kind of why you see this too. I'm always trying to help and kind of meet people where they're at and get them the help that they need. So if we start all the way over here on the AIP protocol, that's kind of like my my kind of beginner level of service. This is kind of it's pretty much do it yourself. It's basically someone comes to me and they're like, I just want to start off with learning how to do an AIP protocol, and I want you to kind of guide me through on what that entails and how to do it and how to implement it. So I have a program that's very reasonable. It's a one-time fee. It's $47 where you can get access to that. And I walk you through that with the trainings and a curriculum and a video course and stuff. I show you, and you do it. I give you some support. I'm not going to let you hang out to dry here. I want to help you to do it successfully. But I basically show you like, okay, here's what foods, for the first 30 days is an elimination process. So it's like, here's what to eat, here's what not to eat for that first 30 days. Here's what foods to eliminate, that kind of stuff. Supplements that I prescribe to my patients that are, really in one of the other two programs. These are the supplements that I prescribe, and here's how to take them. And here is some samples, right? Here's a sample meal plan, for example, like 1 week in a meal plan, right? Like how you can structure it, like breakfast, lunch, dinner, snack book that I wrote, a guidebook, um, which kind of like it's 80 something pages long. It gives you like a 30-day tracking journal if you want to track everything. Email support. You can email me with any questions or help that you might need. The goal being symptom relief in 30 days. In that first 30 days with an AIP protocol. That's the jump start. We use an AIP protocol you can see in all of these, right? So my 90 days to Hashimoto's healing and my one-on-one, we implement an AIP protocol. So you see it's included in all three programs. Okay. In the AIP protocol, this is all we do. And again, some people that's what they want. They're like, I don't want you, I just want to learn how to do an AIP protocol and then we'll go from there. So that's kind of like our bronze level of service. This is included in all of the programs. Now, if you go down to the next step into the silver level, if you will, um, none of this is included in the AIP protocol, but they're both included in the 90 days to Hashimoto's healing and the one-on-one. Then everything that I teach with like me helping you along the way. It doesn't include like one-on-one access that you'll see in the higher level protocols, but it's my most popular one because it gets the right amount of support from me, shows you everything you need. You'll see here in a sec, and gets the job done. It gets the results. It gets people better. That's all that matters. So the 90 days to Hashimoto's healing includes the AIP protocol. Now we're talking root causes, right? So now we're getting both prongs of the attack going here. So with the 90 days, you get a one-on-one with me to get started, right? So we do a kind of a kickstart session with me, 30 minutes. You get that with both of the 90 days and the one-on-one. You get the supplements, the recommended supplements. Now, with the AIP protocol, I will show you which supplements to take and how to take them. They're not included. That's an additional purchase. You can see in the 90 days and the one-on-one, they're actually included in my fees. I'm like, here's the supplements to take. Here's how to take them. They're included in any of my fees. With the 90 days and the one-on-one, the root cause testing. So there's two tests that I recommend out of the gates with patients. One of them is called a Dutch test, and one of them is a genetic health profile. So that's DNA testing. Those are also those we do those two tests along with any other blood work that needs to be done or that you've already had done with both of the 90 days and the one-on-one protocol. And you'll get my interpretation of any test results and any recommendations based on those test results. Okay, in both programs. Every week, I have group coaching calls, call in my office hours. I am available in, I have a private group that the 90 days program and the one-on-one program, you both get to become part of. It's a platform called Circle. It's my online platform, and the only people in there are my patients. I have weekly office hours. You can join. I'm there for everyone to answer questions and offer guidance. I do that weekly. It's like a group call. Usually do one at a time, one person at a time. Um, I give you done for you meal plans, recipes. There's a curriculum where I walk through everything to do, everything, how to do the Dutch test, how to implement the AIP protocol. Like we walk through everything. You get weeks and weeks and weeks and volumes of recipes and meal plans if you need them, right, for implementation. And you can directly message me through the circle group. So there's a direct messaging function. You can message me. I have the app on my phone. It's synced to my phone. So you can message me directly and I'll reply. Either email, like in with the AIP protocol, it's included, or direct messaging through the circle group. So that's really my most popular program because it gets the job done. It covers all the bases, and you can still, and then you get help from me in implementation. You can see you get that with the other ones. Now, the gold level of service is a true exclusive one-on-one. You can see it's personalized one-on-one care. Okay. So you get everything else that we've talked about, except with the one-on-one, you get unlimited. Yes, unlimited. Now, the 90 days to Hashimoto's healing protocol is a 3-month program, right? It's a 3-month protocol. It's a 90-day protocol. The one-on-one with me, I only take a certain number of people per month. It's a 6-month commitment. So we're like, I am your personal doctor, your concierge personal doctor. Some people don't want that. Some people are like, that's exactly what I want. So that's kind of why I have a couple different options. It's personalized. It is one-on-one with me. You get unlimited appointments, one-on-one appointments with me. You get access to my virtual appointment calendar. You can schedule with me. Boom. Set up your weekly. We do them weekly usually, but you can do them unlimited. I meet just like this with you. You will get my personal cell phone number. I use WhatsApp for messaging. You will literally get my personal cell phone number. And as you can see on the next one, that means you can message me whenever. After hours, weekends, I am yours. I am in your back pocket. Whenever you need me, I will get back to you. Again, full concierge physician services. I am at your disposal to implement protocols and to help you with anything else that you need one-on-one. So it's 100% personalized. It's going to be completely tailored to you. You can see obviously there's different levels of investment, right? Like the AIP protocol is a one-time $47 payment. Like, cool, here's how to do it. The 90 days to Hashimoto's healing. Again, my most popular one, that one's 1900 for the 3 months. I have all kinds of payment plans, and we can break that up over a couple of months, or we can spread it out over time. It really gets the job done, and it's really affordable compared to most things that are out there. I think it's the best bang for your buck, to be honest with you. The one-on-one with me is a 6-month commitment. Again, that's very personalized. I devote a ton of time to you. I only take a handful of people per month on this, to be honest with you. That's 650 a month for 6 months. So, I mean, you can do the math on that. It's 3,900 total for 6 months, which again, I think is still very reasonable for the level of service that you get. And again, there's all kinds of payment plans. I give discounts if somebody just wants to pay in advance for that kind of protocol. So that's really it. That's the breakdown. I try and have something for everyone. Like someone's like, I want to get better. Okay, which one's going to be the best option for you? Which one is going to fit into your budget? Which one do you need? Which one would I recommend? Not everyone who comes to me is like, oh, you got to do the high level one-on-one because it's the most expensive thing I offer. That's not the case. That's not what I do. Everyone else out there is doing that. That's not the case with me. I have multiple things that I offer patients for different reasons based on wherever they are and what they want and where they're trying to get to. They all work. An AIP protocol is what it is. That's all it is. Just a way how to do that. The 90 days and the one-on-one both get terrific results. Terrific results with my patients. It just depends on what level of service someone is looking for and what fits into their budget will make it happen. Okay. So hopefully this was helpful. Again, I get these questions a ton, so I want to kind of do this quick little breakdown. If you have any questions, let me know. I'm always here to help. If you want to set up an appointment with me, a consultation, discuss any of this in detail, let me know. Wherever you're seeing this, comment, reply, email me, whatever. I'm always here to help and always open to discussing any of this and tailoring the best option for you. So, Dr. Benedetto, thanks for listening. Hope this was helpful.